Good afternoon, everyone. My name is Stephen Weber, and I am the Director of Marketing and Client Management with USI Affinity. I'd like to welcome you to our webinar presentation today, presented by the American Bar Association for ABA law student members. Both the ABA insurance program and our partner eHealth are very happy that you're able to join us today on this discussion. Our topic today is understanding and navigating health insurance, a Q&A session for ABA law student members. We expect this presentation to take about 15 minutes. Then there will be time afterwards to answer many of your questions that have already been submitted. Throughout the webinar, if you have any questions, please be sure to type them in the Q&A icon message box on the bottom of your screen. During our question and answer session, we will then read through as many as we can, and we will answer them to the best of our knowledge. At this time, I want to go over the agenda that we have planned, which begins with a brief introduction to our panel experts, a little bit about the partnership with eHealth, who is eHealth, the Affordable Care Act, coverage types and qualifying life events, and last but not least, a question and answer session. A little bit more about the partnership. The ABA insurance program, administered by USI Affinity, has partnered with eHealth to offer health insurance for individuals just like you and other ABA members. eHealth, through the ABA insurance program, is a member resource. It can help you find affordable coverage nationwide from many insurance carriers. Whether you're new to shopping for health insurance, already have a health insurance plan in place, eHealth is a resource that will help guide and navigate you. I would like to now introduce our expert speakers, Anthony Lopez and Rachel Rampo. Anthony is the Vice President of Sales and Operations and has been with eHealth for over 15 years. Anthony has been following and keeping a finger on the pulse on health insurance coverage over the past decade and many changes to the insurance environment. Rachel is the Director of Marketing and has been with eHealth for over 7 years, and her focus has been on healthcare and insurance customer communications. Once again, let me say welcome and I thank you for attending. At this time, I will now turn the microphone over to Anthony Lopez.
Thank you, Stephen. It's great to be here today, everybody. Rachel and I are both very, very excited. First, let me say to those that are graduating, congratulations. It's a huge accomplishment. And for the rest that are here to learn just about health insurance, we'll hopefully put on a good show that'll be very informative, and we'll make a very complex subject hopefully very easy. So as Stephen had said, I've been with eHealth Insurance for 15 years and then Blue Shield of California prior to that. My time with both companies has been in the individual and family health insurance space, as well as our small business and most recently our Medicare enrollment and retention teams. So everything that I've been doing over the past 20 years has been related to health insurance, and I'm excited to share my insights with you and answer all of your questions and just have a really great conversation with both Stephen and Rachel.
And hey, Anthony, if I wouldn't mind chiming in here. I'm Rachel. I'm glad to be here with all of you today. I see some questions coming in through Q&A, and the questions I'm seeing so far are things that we do plan on addressing in the upcoming slides. But I will be sure and grab anything out of the Q&A that needs to be answered at the time the slides are in that subject matter. And then we'll also have some Q&A at the very end.
Great, we can go ahead and get started. We can go ahead and go to the next slide. Looks like we might be having a little bit of a glitch. Let's give it just 1 minute and we'll get to the next slide here. So while we're waiting on the next slide, I'm going to go into a little bit about eHealth Insurance and who we are. And hopefully the slides will catch up in just a minute. But eHealth Insurance is an online health insurance and exchange, a private exchange. And we've been in business for over 20 years, and we've helped over 5 million customers, not just in the individual and family, but also in the small business markets, as well as the Medicare. What we do is we really work with those consumers who are looking for health insurance, or they find themselves in a spot where they've lost their job, they're coming off of their parents' coverage, or in a situation like this, you're coming off of your school's coverage. We work in all 50 states. We have carrier supply. We work with all of the major carriers, and we're a free service to you. So if you come to eHealth Insurance, you'll be able to take a look at what all of those options are. You can speak with a licensed agent who will be able to do a needs analysis and really understand your situation, and then make a recommendation. And one of the great features about eHealth Insurance is it's completely online. So you can complete your application once we've made a decision on a plan, and it'll take you about 10 minutes. So in a nutshell, that's who eHealth Insurance is. I'm really excited that I was able to keep close to what the slide was. And I really do want to drive home the point that we're a service for you. So if you just have general questions, you need to speak to somebody, you're uneasy about the situation that you're in, just pick up the phone, call eHealth Insurance. We'll be able to help you navigate all of your options. You may not purchase a plan through eHealth Insurance. We may get you to the appropriate resource, and it's not going to cost you anything. It's a service to the community that we'd love to do. We also would love for you to come through eHealth Insurance if we can do that, but it's not our main goal. So we can go ahead and go to the next slide. So I'm going to touch on the Affordable Care Act. And earlier I said I was going to make a complex problem seem easy. I'm going to do my best. So the Affordable Care Act, or some that have heard referred to as Obamacare, it came into play in 2014, and it impacted the individual and the small group plans, both on the exchange, which is through healthcare.gov or through a state exchange, as well as off the exchange, which is what eHealth Insurance is. So regardless of where you get your health insurance plan, there's 10 benefits that have to be included in order for it to be considered an Affordable Care Act plan. I'll go through these fairly quickly. And as Stephen had said, as Rachel said, we're going to go through questions later. And if we miss any of those questions, we'll certainly follow up with you following the webinar, and we can get you the answers, or you can call into eHealth Insurance. We'll be happy to answer those questions. But hospitalization is, key for any health insurance plan. So if you think about those major instances or major services that you need, if you have to have an appendix out or you end up in the hospital for an extended stay, you want to make sure that those are all covered under the plan, as well as emergency services. I have 3 kids, so if one of them were to break an arm, we've got to go to the emergency room. And depending on what plan, you're going to have some cost sharing. You'll either pay a copay or be subject to your deductible. But for the most part, you're going to be covered. As you look at lab services, so if you're going in to get labs, whatever the case may be, COVID-19 is a hot topic right now. So if you were going in to get some lab work to see if and get tested, that's going to be covered. Maternity and newborn care, for those of you who are looking to have a family or have had a family, having those benefits in place are key. It's very, very expensive, especially if there's any complications. And we've seen it before where maybe the baby is premature and it's a month early. You can look at $500,000 to $1 million in cost. And that's, part of the purpose of having insurance and having these benefits in place to cover you. A big one that wasn't in place prior to the Affordable Care Act was not all the plans included mental health or substance abuse. And these are very, very important. So as you're looking through your benefits and understanding what you need or what you have access to, these benefits are now in place. Prescription drugs, a lot of times this is self-explanatory, but having your generic drugs as well as your brand name drugs, as well as your off-brand drugs, what is the cost going to be to you? These are all going to be included in your plan. And then as you look at rehabilitative services, preventative care and wellness, prior to the Affordable Care Act, if you went in just for a checkup, it could cost you either a copay or it could cost you a couple $100 that would go towards your deductible, or it wasn't covered at all. Now with the Affordable Care Act, your preventative care is just to get a checkup is covered at 100%, and it's no out-of-pocket expense. And that's key for a lot of people, and it's key to keeping our communities healthy. Ambulatory and patient services. So I've been in the industry for a long time, and prior to the Affordable Care Act, you might end up needing to use an ambulance, and that might be something that wasn't covered, and that is now part of the Affordable Care Act and is part of the plan. And then pediatric services for, you know, including oral and vision care. But for those who have young ones, you know, as you were shopping for health insurance, you really had to dig in to make sure that these benefits were covered, and now it's part of the plans, the basic plan package that you select. So this is a really high level on the 10 essential benefits that are part of the Affordable Care Act. And, you know, as I was talking to Stephen this week, I just want to make sure everyone knows that every situation is going to be different. So you definitely want to call and speak to an agent and talk to them about your specific need before you purchase a plan. You can shop on the website, you can do, you know, a lot of the research, but I don't want you to walk away from this presentation and look at these 10 essential benefits and think, oh my God, I have everything covered. Speak to one of our agents, let them walk you through it, tell them what your need is, and we can certainly direct you into the right plan. And we can go ahead and move to the next slide. So coverage types. So this, I did my best to make as simplistic as possible. I get these questions all the time. You know, the Affordable Care Act came out, and I want to be on a platinum plan, or I want to be on a gold plan. What does that mean? There's 4 different levels of coverage under the Affordable Care Act. You have your platinum, your gold, your silver, and your bronze. Your platinum plan is just that. It's the best of the best. And that means that you're going to pay a premium for that in your monthly cost. You're going to pay more for that than your gold, your silver, and definitely your bronze. But you're also going to have more coverage. So the cost sharing between the insurance company and you goes up if you're on a platinum plan, and it goes down on the bronze. So if you think of somebody would be considered healthy, maybe goes to the doctor for their annual checkup, we might go through and take a look at what the premiums are and say a bronze plan is appropriate for you. And what that really means is that you're going to have higher out-of-pocket expense if you end up in the emergency or the hospital. You're going to have a deductible. The insurance carrier is still going to cover you, but you're going to have more out-of-pocket expenses before that insurance company kicks in. If, for me, I have a family of 5, I'm probably looking at the silver or gold. I have a relatively healthy family, but I also have 2 boys that, you know, are in and out of the emergency room from playing different sports, and I know I'm going to have some out-of-pocket expenses. So talking to an agent and really understanding what your health insurance needs are, what your budget is, and what your out-of-pocket expenses are going to be are key to finding the right plan. This is an illustration that you can go back and you can take a look at, you know, when the webinar is over. And then I would encourage you, again, jump on our website. We do a great job of breaking it down, or talk to an agent. You can also go to healthcare.gov, and they have the explanations that will walk you through all of these different scenarios. So at a very high level, these are the 4 type of plans that are available when you're shopping. These are the metallic levels. Within the metallic levels, you're going to have things such as HMO, PPO, and those have to do with your networks and their access to doctors and different benefits. And again, it's very complex. There's a lot of moving pieces. Be more than happy to walk through it and break it down for your particular situation.
Hey, Anthony, we're getting a number of questions where people are asking about moving around from state to state. If they're on our site, and can you maybe walk through how they're going to see these plans displayed on the site depending on where they're looking?
Yeah, absolutely. So when you come to eHealthinsurance.com, it's a very simple process. So you're going to put in your zip code and your date of birth, and you're going to get a list of the plans that are in that particular area. So if you're just traveling from state to state, which, you know, right now there's not a lot of us traveling, but if you're just traveling, you don't want to change plans for that. If you're going to be gone for a month, you're going to have access to the emergency rooms. You'll even have access to doctors that are both in and out of the network. But if you're moving and you're setting up a new residence, you want to keep your plan in place until you have that residence established. And then you want to do your shopping before you even leave the state you're in. Make sure you understand what those plans in. Get your new zip code, put that zip code in. you'll see a list of all of the plans for that particular area. Within those plans, we have great features that will allow you to go in and take a look at the doctor networks and understand, you know, are there 1,000 doctors that are part of this plan, or are there 3 in this specific area? And do you need 1,000 doctors, or are you only going once a year for your general checkup? 3 might be right. The bronze plan might be the best option for you. If you need to go and see multiple doctors and you have multiple specialists, we might be looking at a gold or a platinum plan, and we can look across state lines and take a look at all those options. All right, we can go to the next slide. So qualifying life event. So I saw a lot of questions earlier this week that had come through, and qualifying life event was one of them. There's 4 basic types of qualifying life event. And what a qualifying life event means is if you do not have health insurance, you can only purchase it in the months of October, November, and December. There's a very specific time frame for you to purchase that. So we're in the month of May. If you've been without insurance, the only way that you would be able to pick up a Affordable Care Act plan is if you had a qualifying life event. So if you had a loss of coverage, if you're graduating and you're moving on from school and you lose your school's coverage, that would be considered a qualifying health event. If you're turning 26, as my daughter recently did, she came off of our plan, she was no longer eligible. So she had to get her own either individual insurance or through her employer. Changes in your household. So getting married or divorced, having a baby, or if you adopt a child, or if there's a death in the family. All of these are going to constitute a qualifying life event, and you'll be eligible for coverage. So changes in residence, I touched on this in the previous slide, but if you move to a different zip code, you're eligible for a new plan. A student moving to or from a place they attended school, a lot of you may be in that situation. You've had your coverage in one state, you're moving back home, or you're moving to a state where your new employer is, you're going to be eligible for a new health insurance plan. Seasonal workers, and then moving to or from a shelter or other transitional housing. Excuse me. Other qualifying life events, so changes in your income that affect your coverage you qualify for. Becoming a U.S. citizen, leaving jail or prison. Those are the 4 major ones. And then within those, you would want to speak with an agent and say, you know, do I qualify? So obviously if you turn 26, that's an easy one, you're going to qualify. The time period that you have for that qualifying event is 60 days. So if you wait, 61 days, you're going to be in the lockout period again. There are still some options. There were a lot of questions about gap insurance, which we refer to as short-term insurance, meaning you only need it for 1 month or 2 months. And we have those options as well. Those type of plans are not going to be as comprehensive and have the 10 essential benefits. A short-term plan that's going to cover you for 1 or 2 months, they're going to cover your risk. So if you end up in the emergency room or the hospital, or you have a major event, you're reducing the amount of risk you have because the insurance company will come in after you satisfy a deductible and pay the bills. This is an area, again, where you'd want to speak with an agent and make sure that you understand all of the risk and the cost before you purchase, whether it be a short-term plan or an individual plan. So stop there and see if Rachel has questions for me. Okay.
I do. You read my mind. So lots of questions coming in around qualifying life events. So let's start with one that I see happening here. Turning 26. What is the last day they are eligible to stay on their parents' plan until, on the month they're turning 26?
So it's an excellent question. In most cases and in most states, when you turn 26, you're going to be able to stay on your parents' plan until the end of that calendar month. There are going to be some situations where your coverage ends on your actual birthday. And this is why it's important that you speak with somebody or you talk to the health insurance providers to understand what that rule is. If you're on your parents' plan now, your birthday is coming up, you can jump on the phone, call that insurance carrier's customer service number, and they'll be able to tell you when your coverage will end, whether it's on your birthday or the end of the calendar month.
And then when does that 60-day window to buy kick in? Is it at the birthday or is it the last day of the month?
So it's going to depend on the situation. So if your coverage ends on your birthday, it's going to go 60 days from your birthday. If it's at the end of the month, that's when you lose coverage. So the 60-day window starts from the day you no longer have coverage.
Yeah, great. And then other questions coming through, Anthony, are asking us about income levels in terms of qualifying for plans or being able to purchase certain plans. Do you want to touch a bit on subsidy versus non-subsidy for the metal level plans we were talking on the last slide?
I do. So when we get, I think it's the next slide, I'll actually be doing a deeper dive into the subsidies. So if there's another question outside of that, I'll take that one and we can jump into the subsidies next.
Let's roll.
All right, let's do it. So this is probably the most complex slide for today. So subsidies or credits for your health insurance are based on your income. So if you or your family are making less than 400% of the federal poverty level, you're going to qualify for a subsidy. So for an individual, if you're making less than $49,600, and if you're a family of 4, if you're making less than $103,000, you're going to qualify for a subsidy. So that subsidy is on a sliding scale. So if you're at $49,600 as an individual, or $49,500, you're going to have a really small subsidy. If you look at the example for the single adult on the top left, they're at 133% of the federal poverty level, and it's approximately $15,000 is what they're making annually. So what their subsidy will be, or what they'll end up paying for a health insurance plan, is approximately $39 per month. So as I've walked through this and walked through the health insurance plans and the options, this is by far the most confusing and where we get the most questions. So we have a subsidy calculator on our website, healthcare.gov does as well. All of the state exchanges do. But if this is the first time you're walking through it or the first time you're purchasing health insurance, I highly recommend that you speak with a licensed agent, because this is incredibly complex as far as making sure that you get the right subsidy. Because if you get it wrong and your subsidy is more than what it should have been, you're going to have to pay that back at the end of the year. So it's important to get it right the first time. You can always adjust it throughout the year. So if you're only making $20,000 at the beginning of this year, and you land a job that all of a sudden you're making 35 or 40 or 50,000, your subsidy level is going to change. You can go and make that adjustment. Again, you just want to make sure that you get in front of the right people who can give you the direction and help you walk through that process.
Anthony, how would somebody show their income when they're applying for a subsidy?
So you're not actually going to show your income when you're applying for the subsidy. They're going to ask you on the application. What'll happen is when you file your taxes at the end of the year, that's where they're going to validate if the subsidy that you applied for was accurate. And that's why you want to make sure that you're walking through this with somebody as you're filling out that application and you have the correct information in there. So Stephen, I think that is the end. We can go to the next slide. I think it's going to be for all of the questions. It sounds like there's a lot coming into Rachel. I know Stephen has some great questions, and we can just walk through these, and I'd be more than happy to answer them.
Yeah, so, and as we start to answer some of the questions that come through, please continue to type them in from the Q&A box on the bottom, and we'll address them as time gives us to do so. And I guess, Anthony, I'll.
So some of the questions really around the income, as we were just talking about, is would they be using this year's income or last year's income that has already been reported?
So you want to use what your projected income is going to be for this year. So last year's income should give you an idea. And depending on your situation, as you're looking at what you think you're going to make this year, that's what you want to use.
And if somebody is eligible for Medicaid, are they able to make a choice to apply for a subsidy and get an individual plan?
So if you're eligible for Medicaid, you would not be eligible for the subsidy. You would have to take the Medicaid option. you do have the choice where you can select an individual plan and not take the subsidy. So if for whatever reason you compared those options and you made the determination that I want to go with a more comprehensive plan, or my doctor that I want to see is in the particular network is only available through an individual plan, you can purchase that without a subsidy. There's nothing that says you can't do that.
And if a person has a qualifying life event that they see coming in the future, can they apply early before they actually lose coverage?
Unfortunately not. So when you're completing your application, they're going to ask you the date of the qualifying event. And if it's a future date, that application will not go through. So you have to wait until you've had that qualifying event before you can move forward.
And then there's questions about, do we offer other types of insurance, such as dental, vision? Are there varieties of insurance that we could show them?
Yeah, absolutely. So we have comprehensive packages on our website. So we have our individual and family plans that also are eligible for the subsidy, or what we call a qualified health plan. We also have short-term plans, which, in the questions that I was receiving, a lot of you referred to those as gap plans, but they're actually short-term plans. And those will cover you. You can get those all the way, for an entire year, up to 12 months. And in some states, you can get them for 36 months. Again, those are a higher risk for you, right? So you're going to pay less in your premium. You'll have a deductible, whether it be a $2,500 or a $5,000 deductible. And you'll have to pay that if something major happens, or if you go to the doctors, you're going to pay out of pocket, but you're going to save on your premium. And then we also have the dental and the vision. And then we also have what we call gap insurance in the industry. So if you want to purchase a plan that has a $2,500 or a $5,000 deductible, you can purchase a gap plan that would cover that deductible in case something happens. It's much more affordable than the health insurance plan itself. And it's a great add-on to have a complete package in case something, major or catastrophic happens.
That's great. We've got some questions coming in, really still zeroing in on just what do they do in the meantime between coverages, whereas the short term, as you mentioned, can come in for a couple of months at a time. There's questions about waiting periods. Do we have waiting periods from the time somebody applies?
So the simple answer is no. So a great benefit of the Affordable Care Act is that there's no pre-existing health condition clauses. So prior to the Affordable Care Act, I'll use myself as an example. I would be considered large and I wouldn't be eligible for coverage just because of my weight. So I was excited when that changed. If I needed to purchase an individual plan, they wouldn't hold that against me. If there's diabetes or cancer or whatever the case may be, there's no pre-existing health insurance clause, and there's not a waiting period. There would be waiting periods for dental benefits or for vision benefits, but on your health insurance plan, there won't be any waiting periods.
And then the marketplace plans, talking about our metal level plans, are those on calendar years or are those on policy years?
So in a lot of states, you can do either. The majority are going to be on the calendar. A lot of people purchase their health insurance plans from January through December, but we also work with individuals who are going to come out now. They've lost their coverage and it's the month of May or June, you're graduating. And some carriers will actually have a policy year. So your plan and your deductible will go from June to June or August to August. And then some of those are going to put you on a calendar year. So you want to make sure that you look at the benefits of those particular plans, talk to an agent and ask that question, is this a calendar or a policy year plan? If we're in the month of June and we pick a plan that has a calendar year policy, you end up in the emergency room or hospital, your deductible will reset on January, and then you'll be on a 12-month calendar cycle.
From a high-level perspective, Anthony, how would you say, or how would you suggest would be pros and cons to either choosing a bronze level plan, major medical plan versus a short-term plan?
Yeah, everybody's situation is different. So as you're looking and you're assessing what your needs are for whether it be a bronze plan or a short-term plan, one of the first things you want to do is take a look at what's the duration going to be. So if you're looking at a 30, 60, or 90-day window where you know you have an employer plan that's going to be in place, or whatever the case may be, you're going to get an individual plan in 30 or 60 days. A short-term plan might be the best option for you. You have to weigh that out. If you go to the doctors, you're going to pay out of pocket and it'll go to your deductible. If you go to the emergency room, in most cases, you're going to pay out of pocket and it'll be applied to your deductible. You're going to pay less for that plan unless you're getting a subsidy on the bronze. On the bronze plan, you're going to have a more comprehensive plan. So if you need to go in for your annual checkup, it's going to be free. If you're somebody who gets the sniffles a lot and you need to go in and see the doctor and you want to go once a week, you'll have a copay. So those are the benefits that you want to weigh out, and then what the risk is. Again, speaking with an agent and comparing those benefits online will really give you the insight that you need to make that decision. Welcome back, Stephen.
And perfect timing too.
Thank you. Yeah, I lost some internet connection there. So Rachel, thank you for stepping in there, and hopefully we're still answering some good questions. I'm not sure where we were leaving off, but I'll kind of toss them out there, and hopefully they weren't asked already.
Yeah.
Any new amendments recently due to COVID-19?
There have been some amendments and changes, and it's fluid. It's changing all of the time. So before I go into that answer, I want to say if you have a health insurance plan in place now and you have specific questions about how they're handling COVID-19, I would reach out directly to your health insurance carrier and have that conversation. If you're in the process of shopping, I would also recommend that you speak with somebody and get that question answered for that specific carrier. The majority of the carriers are covering you for the testing, but then it changes from there. So if you end up in the hospital, you're more than likely going to be subject to your deductible. If you're going in for an office visit that's related to COVID, most of the carriers are covering that cost, but you still have a handful where you're going to be responsible for your copay. So while there are a lot of changes and the carriers have really stepped up and in my opinion, really been supportive of the public in helping them through this crisis, I want to make sure you understand those benefits so you know what happens if you need to get the testing done or if you end up in the hospital.
Great, thank you. What are my options if I had not been working during school?
So this is a multi-layered question. So if you haven't been working while you're in school, but you've been on your school coverage and you lose that coverage, that could be considered a qualifying event. If you did not have the school coverage and you did not have any other health insurance, then your option at this time would be to look at some of our alternative or a short-term health insurance plan. So again, this is a situation where everybody is different and there's nuance to this question. So getting on the phone with one of our agents and posing that question and letting them do some probing to really make sure they understand what your current situation is would allow them to say, you know what, a short-term plan or a traditional Affordable Care Act with a subsidy is the right way to go. But the good news is, in either case, you have an option. We can get you covered for something catastrophic through a short-term plan, and more than likely, if you've been on your school plan, we can get you into an individual and family plan.
So
and just clarifying to that question, I'm seeing come through with some of the chat is the subsidies are only for a major medical plan. There are not subsidies for short-term plan options.
That is correct. So the subsidies are for your Affordable Care Act or your credible coverage plan. And so again, that's an important conversation to have. And if you go through, our website and you're taking a look at the short-term options, you'll see that there's no subsidy applied to the short-term plans versus if you go to the individual and family plans and you put your income level in, it'll show you what your potential subsidy would be.
And if we circle back a bit on just the eHealth site and services that we offer, there are some questions coming through about whether or not we have discounted plans for being a part of the ABA membership.
So it's a great question. So across the board in the individual market, there's not a discounted plan. So the Affordable Care Act really put into place that the premium is based on what your income level is. So where you may, if you're going through a group plan, if you think of the ABA as an employee, they may be paying a certain cost for the insurance, and you're paying your cost sharing. So they might pay 80%, you might pay 20%. But that's going to be in an employer-employee relation or a student to school relationship. When you're shopping for individual health insurance, you won't see things such as discounts.
So Anthony, I'll combine two questions together here. First is, what is the length of a special enrollment period after loss of insurance? And then to follow that question is, what if you miss the grace period of that open enrollment window?
Yeah, so the period is 60 days. So from the time you lose coverage, you have 60 days to get into Affordable Care Act plan. After the 60 days, you lose that eligibility into the open enrollment period in October. So one, I would say, as soon as it happens, start shopping for your health insurance, or if you know it's coming up, if you're graduating, you're coming off of your parents' plan, start shopping and get your options in place. If for some reason you miss that 60-day window, then your options are going to be a short-term plan. Taking a look and saying, okay, I'm not eligible for the individual or qualified health plan, but there's still something that's in place that can cover me in case something catastrophic happens. And if you think about an emergency room visit, or, God forbid, somebody gets in a car accident, if there's a bill of, $200,000, $300,000, if you have a short-term plan that's covering, a deductible of $5,000, then it's worth the investment. And I do want to say again, and I'll say this throughout all of the questions, you want to make sure that you understand the benefits that you're purchasing, what it covers and doesn't cover. I wouldn't want anybody to, walk away from here with a blanket statement of, I can go get a short-term plan, I end up in the hospital and everything's covered. You really do want to make sure that you speak with someone and understand the benefits.
Anthony, I'm seeing 3 or 4 questions coming through, just trying to wrap their brain around this 60-day window to apply when they have a qualifying life event. And that's not necessarily the time you have to wait for your application to be approved and for your coverage to begin. So could you kind of touch on the major medical effective date timelines and then the short-term effective date timelines?
Yeah, absolutely. So if I'll use my daughter as an example. So her birthday was in February, and she lost coverage on March 1st. So she actually would have through the month of March and the month of April before she would have to apply. If she waited until mid-April to apply for a health insurance plan, her effective date would be May. So on March 1st, as soon as that coverage ends, you want to have your application submitted and apply for that March 1st effective date. So you have a window, the 60-day window, you're not covered, and it's up to you when you apply for that coverage. And I always recommend, don't take the risk, don't go without insurance. So as you see these events coming up, plan for them. If it's a loss of job, there's a lot of people that it's unexpected, especially during this time. As soon as you lose that job, the majority of the time your benefits are going to cover you through the end of the month. But if they don't, jump on the phone and start having that conversation about when can you get your plan in place. For the short-term plan, you're usually going to be looking at the first of the month. So if you're coming out to eHealth insurance on the 15th of April and you're shopping for a plan, a lot of times those plans won't go into effect until the 1st. We do have some plans that will go into effect the next day. It's going to depend on state and region. And again, speaking with somebody or understanding what those options are going to be key for your health insurance success.
And then retroactive dates, is that a possibility?
So it's a great question, and I hear it all the time. So when you think about retroactive dates, this is what the image I would put in your mind. It's very similar to being in a car accident and then calling the Geico and saying, can I have the insurance back to last week? Well, you can't. So there's no retroactive for the health insurance policy. You have to get it in place before something happens.
And then what happens if you miss your 60-day window?
So you would have to wait until the open enrollment period in the month of October. If your employer offers insurance, you might be eligible there, or you could pick up a short-term plan that would cover you until either you get to the open enrollment period, or you might find that that plan is, you know, a good fit for you, and that's the one that you want to keep in place. So there's always going to be an option. You just need to make sure that you understand what all of those options are.
Anthony, here's a good question I think I wanted to put out there. Does eHealth offer coverage in all 50 states?
We do offer coverage in all 50 states. It gets a little bit tricky. So depending on what state you are and what county you are, you're going to see a different amount of supply. So in some of the rural areas, you might have no supply, or you might only have one carrier. Regardless of what we offer through eHealth insurance, if you reach out to us, you speak to our agent, we can get you to the resource if we don't have a particular carrier that you're looking for, whether that be through healthcare.gov or through a state exchange, or we understand what the market is and the carriers are in your specific area. We can give you the direction and help you out.
So lots of the questions are around getting health insurance during a short period of time while people are finishing school, testing for the bar, and gaining employment where they will have employer sponsored. If somebody chooses a short-term or a major medical plan and then becomes employed, can they cancel anytime?
So another excellent question. So health insurance policies are month to month. So you can't cancel, just say today, I want to cancel my insurance. But if you purchase it on, let's say my employment was going to start on April 1st or in the month of April, I can reach out to my insurance company now and say, I want to cancel my insurance on April 1st. You'll be covered through the month of March. And in some cases, you might have a 2-week overlap if you're picking up your employer insurance and you just didn't find out in time. But you're not locked into a contract, an annual contract. As long as you're making your monthly premiums, your insurance will continue and be in place. And once you decide to cancel that plan, it usually is going to cancel on the first of the following month.
I think a good question to go off of that, Anthony, is the effective date. Does it always begin the first of the following month?
It does not. It varies. So you can either, in most cases, you can either get the 15th or the 1st, and it's going to depend by carrier. It's going to depend by state. On your short-term options, like I said, there's some areas where you can get it any day of the month. Really understanding what those options are and coming out to eHealth insurance or going to healthcare.gov, speaking with an agent and saying, hey, this is my situation. Here's when I need insurance to start. What carriers are going to be best for me to fit my particular need?
I'm seeing a number of questions come through, trying to understand the difference between using eHealth for subsidy applications or non-subsidy applications, or just going straight to healthcare.gov in the marketplace with.
Yeah, so what's key is the cost is going to be the exact same to you. So you're not being charged a fee by using eHealth insurance. We have a relationship with the carrier, so we're free to you. The difference is going to be in the service level. So healthcare.gov is a great resource. And if you reach out and you're trying to get somebody online, you might have a different experience than if you contact eHealth insurance. We have dedicated agents. We're licensed agents. We are not compensated on what you purchase. Our agents are there to support you regardless of what plan or carrier you go with. And we'll walk through your need and do a in-depth needs analysis, and then we'll make a recommendation. Hopefully you purchase through eHealth insurance. Majority of the time you can find the same plan through healthcare.gov. I would say ours is, we've simplified the process to apply directly to the carrier through our online tools.
Anthony, I'll read a question here. I have a pre-existing condition. How will that affect my health insurance coverage, choices of coverage?
So first off, you're eligible for an individual or subsidy eligible plan. So you cannot be denied because you have a pre-existing health condition. What's important to understand is what benefits and what your out-of-pocket expenses are going to be. So a bronze plan might not be the right plan for you. It's a lower monthly premium, but you're going to end up paying more for your labs or for your doctor visits until you satisfy your deductible. So again, everybody's situation is different. The medications that they're taking, the treatment that they're getting, understanding what the options are out there and then how that applies to your specific situation is exactly what an agent's job is to do for you, really help you navigate through all of the noise and all of the different plans and say, hey, here's a couple of great options from different carriers. Here's what your out-of-pocket expenses are going to be, and here's how this plan will work for you.
Here's a question that
These are amazing questions.
Here's a question that I think you kind of covered, but it's probably good just to reinforce. If you are studying for a state bar that outside of your current residence, where should you seek medical coverage?
Another excellent question. So it's going to depend on your specific situation. So if you're traveling away from your home, obviously, and you're in a different state, if you have a plan in place, you want to check. I'll use California and Texas just to make it easy. If you live in California and you're studying in Texas, you can purchase a plan in California. What you want to make sure is that your network and your doctors and everything is going to be covered where you're staying at in Texas. You can also apply in the state of Texas. There's going to be some specific rules around that. You might have some areas where you are going to have to apply in California. Again, because it's so confusing and every situation is different, you're going to want to make sure you talk to somebody. The good news is, in either case, you're able to have health insurance coverage and your needs can be taken care of. You just want to make sure that you make the right choice and your doctors and your hospitals that you're concerned about are part of your network.
Here's another question I'll toss out to you. And I think this is one where every scenario is different, but what is the best way to choose between whether you want to be on your own or your spouse's insurance?
These are fantastic questions. So there's a couple things that you want to do here. So if you understand the benefits and you understand what the out-of-pocket expenses are, you can put them into a spreadsheet and you can put them side by side. What is my monthly premium going to be for my spouse's plan versus if I go on the individual? Am I subsidy eligible if I go on the individual, and does that reduce my cost? What are the doctor visits? What are the prescription costs? What are the lab and x-rays? All of those factors come into play when you look at a 12-month period and say, what's the risk if something major happens and what my out-of-pocket expense is? So if you speak with an agent, they'll run through those lists of questions and help you navigate through making sure that you're asking all of the right questions. And again, it's really just comparing what those out-of-pocket expenses are and what your risk is going to be.
Some great questions coming in around what to do if they have to wait for the effective date for the following month to begin. So they apply, for example, the second week of April and the effective date is May 1st. What would they do in that time period?
So this is probably one of the best scenarios to see if there's a short-term plan that has a next day effective date. So if it's a 2-week period, you can only purchase a short-term plan for a 4-week. You can't have it just for 2 weeks. So you'd have a little bit extra coverage. But I'd reach out to eHealth. I'd talk to one of the agents and say, listen, I don't want to go without coverage for 2 weeks. What are my options for a short-term plan? What are the deductibles? What are my risks if I end up in the hospital over this period? So there are plans and options that are available.
Another great question just came in about making a choice between employer-sponsored insurance or buying directly for themselves. Things that people should think about when they're comparing what their options are, Anthony.
Yeah, so this is very similar to comparing your options between yourself and your spouse's coverage. So if your employer is covering 100% of your cost and you have a no deductible plan and you pay $5 when you go to the doctor, it's a no-brainer. Go with your employer plan. That's not typically the case, right? Your employer is going to pay somewhere, usually, typically between 50 to 70 or 80% of the monthly cost. What are the deductibles between the two plans? What's your income, and are you eligible for a subsidy? And what's your monthly premium if you purchase it on your own? Can you purchase a platinum plan that's better than your group health insurance plan for a lower premium? Then maybe IFP is the option. So again, these are things that you can put into a spreadsheet. You can write them all down and do all the comparison. You can jump on the phone and speak with an agent. If you just want to use eHealth insurance to compare what the plans are available to what your employer is offering, you never have to talk to anybody. You can see all of the benefits for a particular plan right on the website, and you can do the comparison and out-of-pocket cost comparison yourself.
Great. Thank you, Anthony. We'll ask a couple more questions. I just want to be sensitive to the time here because I do want to share. We have one slide that does show the resources that you do have access to as an ABA member for you to call in to eHealth or to navigate on your own if you wish to do so. But here's a couple questions we'll go through. I think this is a question that's going to be case by case, but how do I successfully get the best health insurance for the least amount of money? So it's probably something everyone would like to know. I don't think there's a silver bullet, but I'll let you answer that, Anthony.
Yeah, so you want to talk to an agent. It's the best way. I mean, so I don't want to get into, be the sales guy, but at the same time, if you want to get the best plan for the least amount of money, you want to talk to an expert. So your subsidy, your income and your subsidy eligibility, what your risk is, based on the benefits that you're selecting, how many options do you have? So if you're coming to eHealth insurance, you saw on our previous slide, we have over 200 carriers that we work with. We work with the major carriers as well as the regional carriers. So choice and selection is going to allow you to drive that cost down. So that to me is by far the easiest way to make sure that you're getting the best deal or the best plan is through options and making sure that you talk to somebody who can help you navigate through all of those options.
I think this is a good question as well, Anthony. When it comes to paying your premium on a monthly basis, if you are unable to do so, is there a grace period where you would still have coverage if a scenario was to occur?
So typically, make sure everybody understands, typically you have a 30-day grace period. During this time with COVID-19, the health insurance carriers have loosened some of those rules up just because there's been hardship across our country. You want to make sure that you talk to your health insurance carrier, understand what that grace period is. And that grace period doesn't mean that you get to skip that payment. You still have to make it. So if you miss it this month, you're going to have to double it up next month. And this is a common question. We run into it all the time. We work with individuals. We help them navigate and help them try to come up with a solution for the situation that they're in.
Great, thank you. Rachel, is there anything else that came through during these conversations we wanted to ask?
I'm seeing a number of questions that are restating some of the things that we've been discussing. So what we'd like to do is put this into like a response form and get this back out to everybody after the webinar. That might help as we refresh on some of these topics that we've talked about already.
Wonderful. Well, we'll advance to the last slide here. And thank you, Anthony, for answering a lot of those questions. But we wanted to share with you that obviously this is a resource that you do have access to. There's a URL that would provide you additional information. There's also a frequently asked question PDF document that would also help you guys in navigating this. There's the phone number that you can call to speak to a representative. You should at least go through the process on your own, and I think you might come up with more questions that you might want to speak to a representative and talk through. But this is obviously a resource, and this is the partnership that we have with eHealth. So I do recommend, if you are exploring, to use this resource, and here's the following links. And I also did want to provide Anthony's email address. Feel free to reach out to him directly, and he'll be able to navigate you to the right team member on his end. But we do hope that you found this to be informational. We do hope that a lot of your questions were answered. And for anything that you do have going forward, please feel free to reach out. But Anthony, thank you, and Rachel, I thank you for joining us today. At this time, the webinar presentation will be ending. So thank you to all who attended, and thank you, Anthony and Rachel.
Yeah, thank you to everybody. Really appreciate the opportunity to speak with you today.